Even though data has not yet been released for 2017, the Caribbean Partnership Against HIV/AIDS has applauded the local authorities for their efforts to support the fight against the disease. Director of Pancap, Mr. Derek Springer, explained that between 2001 and 2013, the Caribbean region had the sharpest decline in new HIV infections when compared to other continental districts. Locally, the director explained that with a decrease in donor funding, Guyana has managed to pool enough resources to continue advocacy, treatment, and care for those living with the disease.
It is important, though, that we are not complacent, and we have to ensure that we continue to address prevention. We need to look at combination prevention, so we have to look at treatment for the people who are living with HIV, so that when those persons are treated and they remain on treatment and they become virally suppressed, it means they cannot transmit HIV.
There were an estimated 310,000 people living with HIV in the Caribbean at the end of 2016, with 5 countries accounting for 92%. Those countries are Haiti, the Dominican Republic, Jamaica, Cuba, and Trinidad and Tobago. Mr. Springer, however, encouraged local advocacy bodies to pay keen attention to the key population of youths who stand more at risk of infection.
We are also encouraging persons to look at abstinence, particularly very young persons, adolescents who would like to experiment with sex, for them to really understand the dangers that HIV present, as well as other sexually transmitted infection. So it's important that we are not complacent.
According to the UN AIDS 2016 country report, there were less than 1,000 new infections recorded, with less than 200 deaths. The report also outlined that at the end of 2016, there were in excess of 8,500 people living with the HIV/AIDS virus. Javon Vickery, HGP Nightly News.